Hi, this is Dr. Melissa Liepins-Masek from Missouri Eye Consultants, and today I'd like to talk with you about contact lenses after the age of 40. After the age of 40, all of our focusing and visual systems go through a little bit of a change. What you might find yourself actually noticing is that when you are looking at things at near, such as your phone or your computer, that things might not be quite as clear. And you're going to find yourself actually maybe holding things a little bit further away to see, or maybe you're peeking underneath your glasses or wanting to see better by taking your contact lenses out. That is a normal change that's going to happen to us if we live long enough. I always tell my patients, it's good. We got to live long enough to have this change happen. When this change begins to happen, we have to rethink a little bit about what's going on with your contact lenses. No longer will those contact lenses, that made us see great both far away and up close work. We actually need to do some changes to them to make our vision function maximally both far away and up close. So there are three really great ways that I discuss with my patients in terms of being able to maximize our vision both far away and up close with contact lenses. So the first option that I talk about is actually staying with our very same contact lenses that we were already wearing, but introducing a pair of reading glasses over the top of those. So we would leave your contact lenses that keep you seeing clear for distance the same and prescribe you a pair of reading glasses. You would put those reading glasses on when you were on your computer, looking at your phone, or reading some paperwork up close. That would provide you clear vision both far away and up close without us having to make a lot of changes to your actual contact lenses that you're using right now. Downsides to that system there is just, that some feel it's a little bit cumbersome to be putting their glasses on and off. Some people also tell me, well, I'm already wearing contacts and now I'm wearing glasses. I don't want to really be wearing both of those. So it really depends upon the individual if this works for them or not. I do think that this gives patients our clearest vision because we're able to use both eyes, looking both far away and up close. Both eyes together when doing those things. So I do think, it keeps us having depth perception and seeing a little better. The downside, of course, being that we kind of have to be tied to those reader glasses and they need to be around us. So that is option number one that I talk about. Number two option that I talk about is something called monovision. And I always tell my patients, you got to bear with me as I talk about this because when you hear it at first, it sounds pretty insane that your brain could actually adapt to something like this. But I say about 65% of my patients are able to adapt and are really successful in monovision contact lenses. So what is monovision, you ask? So monovision, can work for people who are both far-sighted or nearsighted. If we are nearsighted, essentially what we are kind of using is our own nearsightedness to our advantage. So nearsighted folks, I say, turn the word around. They are sighted for the near. So they see, well when they're looking up close without their prescription. So we're using your own natural nearsightedness to give you vision up close. So what we will do is we will determine which eye is going to be a far away eye and which eye is going to be an up close eye. So mono means one. So we have one eye seeing at each distance there. So when we do the exam for this, what we are going to do is determine which eye is your dominant eye. I have a little test that I can do in the office that will help us determine which eye that is. Oftentimes, I'll also ask if you have a shooting eye or if you had, before we had phones and we took pictures out here with our phones, and we had cameras, if you would pull a camera, to your right or to your left eye, that will help me determine which one is going to be your dominant eye. And that is the one that is going to be your distance eye. So for most people, we are not changing anything about that contact lens for your distance eye. It's just the one that you were wearing before. For the reading eye, which is your non-dominant eye, then I'm usually going to change the power of that contact lens to tailor your vision for being up close. So in nearsighted folks, I'm actually using a lower powered contact lens and using your own nearsightedness to see up close. For folks who are farsighted, I'm going to be adding additional power to your contact lens that will help you see up close. So yes, that is correct. I now have one eye that is seeing far away and one eye that is seeing up close. So sounds kind of weird, right? Don't knock it till you try it. Like I said, most people do really, really well with it. And we walk around with both eyes open. So with both eyes open, we're able to see both far away and up close without many issues there. Questions people ask again is it going to make me feel like I have a headache or off balance? We don't really know until you try it. So we're going to send you home in some trial contact lenses first, to see how you get adapted to that. There is a 35% of people where it doesn't work, but we don't know until we try. I know there is some statistic, and I can't remember the exact number of it, but I remember learning it in school that, there is a good number of American presidents who wear monovision glasses or monovision contact lenses. You never really see them wearing glasses. And so a lot of presidents are actually wearing monovision contact lenses for that. So what are the drawbacks to monovision, you may be asking? I think the number one would be that depth perception is definitely affected a little bit when you have monovision. To have true depth perception, we have to have both eyes working together. And so with monovision, we do have two eyes working separately. So some people do feel like their depth perception is a little hindered when they have those on. The other biggest complaint that I probably get from patients would be that nighttime driving might feel a little bit more difficult to them. Having one eye tailored for near and the other for far seems to give us a little bit more symptoms with nighttime driving than it does with daytime driving. If that is the case, we can get around that. I do have some patients that we still will, prescribe 2 distance contact lenses, as well as just a near contact lens that they can use. So maybe they'll switch into their distance contact lens for driving at night. What I love to recommend is actually just getting a pair of glasses that will fully correct that reading eye for distance that you can leave in the car. So you can just throw those on for nighttime driving. You're able to see clearly when you arrive at your destination. You can take them off, and then you'll be doing well again, seeing both far and up close. Another benefit that I do like about monovision is that it doesn't change your contact lens brand or the cost. Since we are using your very same contact lens brand that you liked before, and I'm just playing with the powers, there's no additional cost, to wearing monovision contact lenses. The third option is something that is called a multifocal contact lens. So it works similarly to a progressive or a bifocal pair of glasses. So in that case, it does, have a little benefit over monovision because we do have both eyes looking, seeing for far away, both eyes for seeing, intermediate or computer vision, as well as for our up close vision. So we definitely have the benefit of not having to use the eye separately. They're being used together with that. The next question I always get about this is, am I going to have to move my head just like I do with my bifocal glasses to see clearly? The great news is no, you do not have to. Since that contact lens is actually on the eye, it eliminates that positioning of where you need to look. These contact lenses, interestingly, they are designed on a system of rings. So it has a system of a ring for your up close vision, and it has a ring for your distance vision. And so depending on your pupil size, we do know that when you look far away with your contact lenses on, or just when you're looking far away in general, our pupil size gets larger. When our pupil gets larger, there is a ring of prescription that helps enhance our distance vision in those contact lenses. When we are reading or looking up close, we know that physiologically our pupils get smaller. So when we are wearing those contact lenses for up close, our pupil will get smaller and it will hit that ring of prescription for reading. So that works pretty well. That being said, I think one of the biggest drawbacks that we find with the multifocal contact lens is, to fit all of our needs into this little tiny contact lens, we do have to usually take a little bit away from your distance vision to give to your near vision. So some patients are not a fan of that. They feel like, my distance vision was already good and I really don't want to sacrifice that to see better up close. But again, we don't really know until we try it. But I'd say that's one of the downsides of those costs. These contact lenses are a little bit more expensive than your traditional lenses. But again, work very well for a lot of people. When I talk about contact lenses after 40 with folks, usually I do, discuss either at the beginning of our conversation or at the end that we oftentimes have to set our expectations just a tiny little bit lower. That's a lot of vision to get into one tiny little contact lens. And oftentimes the vision may not be quite as strong as it was in just your distance contact lenses or in something like a progressive pair of glasses. I like to talk about contact lenses after 40 kind of like a teeter-totter. In the sense that we're trying to find a balance between, your near vision and your distance vision here. And I want to try to find a nice balance between the two of those. If I make your distance vision too strong, I'm going to tank your near vision, and vice versa. If I make your near vision too good, I might take a little bit away from the distance. So I'm always looking for, a happy medium. Now it's more fun when the teeter-totter works, and we've got, each are doing great, but that's not how teeter-totters work. So sometimes we need to set our expectations just a tiny little bit lower. But again, the goal is to find you balanced vision when we're looking both far away and up close in our contact lenses. So these are the three options that I often talk about with my patients when we are in our 40s and starting to have presbyopia or that need for a little bit of near correction as well. And I hope you learned a little bit about that. If you have more questions, feel free to reach out to one of us. We love talking about these things. All of our doctors here are proficient in fitting contact lenses after 40, and we'd love to speak with you. Thanks for listening with me today.